Recently, a woman from Knox County, a coastal and fishing area on Maine's east coast, died from a tick-borne disease called Powassan virus. Joining me on the phone to discuss this infectious disease further is Dr. Sheila Pinette. Dr. Pinette is the director of the Maine Centers for Disease Control. Good morning, Dr. Pinette, and thanks for taking the time to talk to me today.
Good morning. Thank you for having me.
You bet. The patient in question, it was a 73-year-old woman, and she contracted the virus in early November and passed away in mid-December. For my listeners and readers of the website, what exactly is Powassan virus? The symptoms, the transmission, etc.
Okay, Powassan virus is actually a tick-borne virus that's spread by two different types of ticks. We believe it's spread by the same tick that passes on Lyme disease and anaplasmosis and babesiosis, known as Ixodes scapularis tick, which is also known as the deer tick or black-legged tick, and also the woodchuck tick, and that strain is known as Ixodes cooki, Cookei.
Okay.
And the symptoms are actually variable. There are a lot of neurologic symptoms. You can present with fever, muscle weakness, lethargy, diarrhea, anorexia, visual disturbances, lack of balance when you walk, confusion, difficulty talking, severe headaches. Pretty much it presents as a meningitis oftentimes or an encephalitis. But remember, in the last 10 years, there's only been 50 cases reported nationally. And this is the first case we have diagnosed in the state of Maine in the last 10 years.
Oh, okay. Wow. And what exactly is you had a patient that died. So what is the case fatality rate for this viral disease? Actually,
based on the literature, we have found that it's probably a fatality rate of approximately 10 to 15%. The actual virus was first brought to light in the 1950s when it came to the eastern hemisphere of North America and Canada. And during that time, between 1958 and 1998, they had approximately 27 cases reported between Canada and the United States of Powassan virus.
Yeah, and the patient in question from Maine, it appears like she was sick for weeks before she passed away. Is this the typical course of the disease, or is there not a typical course of the disease?
Because it's not very common, that is probably the course of the disease. It tends to have a lot of neurologic symptoms when it presents, and it does have a mortality rate of 10 to 15%. Because we don't see it very often, this is the typical case that is seen and reported in the literature. Unfortunately, there is no treatment other than supportive therapies, IV fluids, and respiratory support. Oftentimes these people need hospitalization. I do know that she was tested for a large number of different types of diseases that cause meningitis and encephalitis, and Powassan was early on part of the differential diagnosis, and they did have a prelim positive for that test early on, but to get confirmation, the test was actually sent to Fort Collins, Colorado, where the federal CDC has its arbovirus laboratory, and they did confirm that virus positive just before her death.
Right. And you pointed out that Powassan is pretty rare. Where else is it found besides the Northeast?
Well, we really know that nationally most of it is found in the Northeast, just as you see. There's only about 16 states that you actually find Lyme disease, and that's usually anywhere from Delaware up to the northern part, as well as Ohio and Michigan. Tends to be following along coastal waterways and thick, heavily laden forest, long grass, and lots of leaf litter on the ground.
Okay. Well, let me switch gears a little bit. A couple of weeks ago, your office released the latest numbers for tick-borne diseases in Maine. It found that the three main tick-borne diseases, Lyme, Babesia, and Anaplasma, increased in numbers, not dramatically, but they did increase from 2012. Any thoughts on that? Is it just because of better testing, or?
Well, actually, the
What do
number
you got?
in 2012 was 1,111 reported cases to the CDC. Remember that Lyme disease is a reportable illness. This year, in 2013, to date, we have 1,285. Myself and the epidemiologist are out there educating providers and also helping to make the public more aware that they have to advocate for their own health care as well, to make sure that when they are having symptoms of possible Lyme, or if they present with a rash, or they have extreme fatigue and fever that doesn't go away, that they really need to enter into a relationship with their physician to be screened for Lyme disease and treated early on so that they don't go for long periods of time and develop sequela, neurologic or cardiac or arthralgias from Lyme disease if it's left untreated. We believe that Lyme disease goes unreported nationally as well in our state, and it's probably underestimated by 10 to 12-fold in terms of cases. In fact, in August, the federal CDC reported that even though nationally we report 30,000, there's probably 300,000 cases that are out there each year. Many that go undiagnosed. Yeah. Mm-hmm.
Okay. Well, I've been talking to Dr. Sheila Pinette, the director of the Maine CDC. Dr. Pinette, thanks for your time and expertise. I appreciate it.
Thank you very much. Have a good day.
You bet.
Bye-bye.
You too. Bye-bye.